Hi, in this video we'd like to talk about the diagnosis and treatment of endometriosis. Endometriosis is a common condition, very common during your fertile periods later on. It happens, especially those who have a late pregnancy towards an advanced age, or those who have never given birth. They usually will develop endometriosis, and this condition can be diagnosed and treated. However, diagnosis needs to be done properly, otherwise treatment will not be effective. So endometriosis is simply the displacement of endometrial tissue, and it can grow anywhere outside the endometrium, outside the uterus, the fallopian tube, pelvic cavity, the cervix, many places. It depends on where it is, then we need to do the appropriate treatment of removal. So diagnosis is sometimes difficult because we cannot find where it has gone displaced to. So if you cannot find the location, it's very hard to give you proper treatment because we need to remove the displaced tissue. So symptoms of endometriosis, I'll give you two distinct symptoms. Firstly is you'll have extreme menses pain. It's very commonly associated with endometriosis. And some women have reported that even after marriage, so after their first sexual intercourse experience, it gets worse over time. So it's something that needs to be diagnosed and treated. You should not ignore it. If you have extreme menses pain, it's not normal, and you shouldn't just endure it. You should go to your doctor, get it checked. And the next distinct symptom of endometriosis is pain during sexual intercourse. Pain and difficulty, sometimes bleeding as well. If you have these symptoms, it's very commonly associated with endometriosis, and you should receive appropriate treatment. So diagnosis is done using, firstly, ultrasound. Ultrasound will allow us to find these displaced tissues. They will look like cysts in the ultrasound image, and we can know exactly where the location is and also the size of the cysts, which are these tissues. Secondly, we will also do a pelvic examination to examine where it has displaced to, for example, in the pelvic cavity, outside the uterus, behind the uterus. These are hard to reach places, hard to find places. These are pelvic examinations, very important. Next one is a MRI imaging. Sometimes it also allows us to help properly pinpoint this location, and it also helps our doctors to plan the surgery, because MRI will give us a very precise image and location, so we can do a proper surgery. The gold standard, however, is definitely laparoscopic diagnosis, because it allows us to exactly pinpoint the location, the size, because it gives us direct visualization, and at the same time we can directly go into treatment by removing this displaced tissue. So it's very important that we use laparoscopic diagnosis immediately, so that you only do surgery one time, diagnosis and treatment together. That's how we do it here at Antai Hospital. And once you have these tissues pinpointed, each of these locations, then we can do the surgery of removing them one by one, depending on where they are located. And this is also done using 3D laparoscopy. The surgery is minimally invasive. There's no scarring. There's no post-operative scarring as well. And then it's rather painless because we will be applying local anesthesia. Upon recovery, after you are discharged from the hospital, you will realize that your menses pains are significantly reduced, your cramps are not so severe anymore, and then you can also go on to begin your fertile conceiving journey. You'll have pregnancies with no complications, and your sex life will also improve greatly because there's no more pains anymore. So Antai Hospital offers a full contractual treatment, a full refund guarantee for patients who have this condition. You can come to us to seek diagnosis and treatment. If you do experience another failure in pregnancy or treatment outcome is unsatisfactory, then we offer you a full refund. Get in touch with us via the website and the link above, and also leave me a comment down below.